So, hi everybody. Thank you once again for joining us on your favorite chat series, the Fireside Chat series on the Ghanaian American Journal. Today, I join you as your standing host, and my name is Deborah Echampong. And this afternoon, I'm joined here by a very lovely lady, Lydia from Pong, who is going to talk to us about diabetes. She says, "Diabetes, know your risk and stay aware." Diabetes, anybody that hears of diabetes freaks out, and there's the perception that I am going to die once I am diagnosed with diabetes. But today, as you stick and stay with us on this conversation, you'll realize that diabetes is not a life sentence. Diabetes is not curable, but diabetes is manageable. And so don't go anywhere, and let's have this wonderful conversation with Lydia from Frimpong, who is the founder and CEO of Frankel Foundation for Diabetes. Lydia, welcome to the Ghanaian American Journal.
Thank you, Deborah. I'm honored to be here.
Awesome. Thank you so much for joining me and for being willing to share with us and educate us about diabetes, which I believe is a very serious disease that
Mhm.
sometimes people sideline and don't talk about. And so let's zoom right into the conversation by telling us what Frankel Foundation is.
Okay, thank you so much. First of all, let me say hi to your viewers. I'm honored to be on this platform this afternoon. Well, Frankel, the name came about when my son was diagnosed. My son's name is Frank, and my mom is Elizabeth. So I put his first name Frank. Then I used the first two initials of my mom's first name and added to Frank, and it became Frankel. And it was founded in 2018. And our main dedication is to serve, represent, and support people living with diabetes and their families especially, and for those who don't have access to health clinics, hospitals, and health centers. So our mission is to create awareness about this deadly disease, and to just help people living with diabetes and their families. And our vision is to reduce the existence of diabetes and to improve the quality of life of those diagnosed and those yet to be diagnosed, and to inspire them that living with diabetes is not a death sentence. And this gives them a better, like a brighter and a better tomorrow.
Thank you so much. So, just to since you are advocating for diabetes, just to know the team members, we want you to give us an insight into the people who are on your team, just so people know that Frankel Foundation has the expertise, and if they say they are advocates, they are really doing something great.
Okay, I'm so lucky, 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 lucky. I have a very wonderful team, and my team is I have a team here in the US, and then I have a team back home in Ghana. And my team is made up of patients, I would say those living with diabetes, parents with kids or family members or daughters with diabetes, then other people. And those people, either their mother or their father or their grandmother or their granddad, at least one member of the family has diabetes. So I'm so lucky. And most, I would say most 99% of my team is healthcare professionals. We have doctors, we have nurses, and we have CNAs, home health aides, you name it. So I'm so lucky to have them on board.
Awesome. Thank you so much. And we'll get into you giving us a bit of education on diabetes. And
Mhm.
the few I know about diabetes is diabetes can be hereditary, and coming from a family line where there's a track record of somebody having diabetes in my family. I know that it's a very essential conversation, not just to my audience out there, but
Mhm.
also to me as a person hosting you today.
Mhm.
So, if you can enlighten us, what is diabetes? What are the risk factors? What are some of the causes of diabetes?
Okay, thank you very much. Diabetes is a chronic condition whereby the body is unable to process glucose. When we eat, when we eat, we have this, everybody has this pancreas, and it's a small organ beneath the stomach. And this pancreas, inside that pancreas has these cells called beta cells. These beta cells produce a hormone called insulin. So when we eat, our food, our carbohydrate especially, turn into glucose, then this pancreas releases this hormone insulin. Then it turns the glucose to energy. So that's the energy that we get to run, energy we get to talk, all of that. They are all the work of the glucose and the hormone insulin coming together to turn into energy. So when you have diabetes, it's whereby your body cannot process that glucose. That is, the pancreas is either damaged, not producing insulin at all, or it's not producing enough insulin for you, or it's producing all right insulin, but due to being obese, it's not able to cover the amount of food or amount of carbohydrate that you eat, leaving the glucose to be in the bloodstream. So it makes your blood sugar go high. So when it happens, then it turns to diabetes, like you have this disease. Yes. Then we have type 1, we have type 2, then we have gestational diabetes. So with the type 1, I would say it's like an autoimmune, Your body is attacking the cells in the pancreas and destroying it. So you're not producing insulin at all. But with the type 2, you're either producing all right, or you are not producing, the pancreas is not producing enough. So with that type 2, you can correct it. You cannot cure it, but you can manage it. You can bring it under, because you can, the doctor will give you medication, whatever, to stimulate the pancreas to produce enough insulin. But with the type 1, it's like you depend solely on the insulin for your life, for your day-to-day stuff. Without the insulin, you cannot live. Somebody like me and my son, we live solely on insulin. So somebody will ask, okay, what are the causes? We don't know the causes. Or we will say that we have risk factors. Risk factors can be age, it can be family history, it can be your lifestyle. So with the type 1, usually we inherit type 1. But with the type 2, although type 2 can be inherited, if you have a family issue, that doesn't mean definitely you're going to have diabetes. No. But if you take very good care of yourself, you ride, you exercise, you can prevent yourself from getting diabetes. But with the type 1, you have no choice. You live solely on insulin. With type 1 too, we can manage it. You can manage it by also taking your medication, making sure that you take your insulin. And with the gestational diabetes, it's for the ladies or the women usually get it when they are pregnant. And these women are at risk for developing type 2 diabetes in the future. So you see the difference?
Yeah.
Type 1, you depend solely, your pancreas doesn't produce insulin at all. Type 2 is either it's not producing enough or producing all right, but just your body is rejecting it. Yes.
Thank you so much for that education. I must say that I appreciate this education very well because I had always thought that the difference between type 1 and type 2 is that type 1 is when you are initially diagnosed of diabetes, and then when it worsens, you get to type 2. And so, yeah, so it's not just my audience learning, it is me here sitting here that is learning.
Yeah.
And somebody would say that I'd already mentioned that I have a family record of somebody suffering from diabetes, and why don't I know this? Because that's fear.
Yes.
There's fear, knowing the fear alone doesn't even sometimes make me want to read about it,
Yes.
because
Yes.
I know that some of the risk factors of getting diabetes is having a family track record.
Yes.
And so as with somebody living with diabetes like yourself, you want to share a personal experience on being diagnosed on being diagnosed that you are diabetic, and how you overcame it, and now you are an advocate for diabetes.
Thank you so much. It's a long story, but I'll cut it short. So I came to America 1998, June, August. I got so sick. and my friend took me to the ER. So when I went, they did all the tests you can imagine.
mm,
So the doctor approached me and was like, "Oh, ma'am, do your any of your family members have diabetes?" I'm like, "Yeah, I remember my mom telling me a while ago that she has diabetes, but I don't know, you know." And he was like, "Well, we've done this blood work on you called hemoglobin A1C, and yours is like 13.5, 13, between 13
mm,
and 13.5. Yeah, I remember. Yeah, either 13 or 13.5. So you need to go find a PCP, and they can take, like, they'll continue with you, like they will appoint you an endocrinologist or a diabetes doctor, diabetic, and all that." So I'm like, "Okay, Deborah, I had just landed in America 2 months ago. Okay, I'm here to hustle to get money.
mm,
So now you telling me, oh, you have diabetes, blah, blah, blah." I'm like, okay. So I was in denial for all these years. All these years, Deborah, I was in denial. So when I got pregnant with my son, I was diagnosed with gestational diabetes. I'm like, oh my God, what the doctor said in New York is kind of
mm,
true or something. But still, so I was able to, after my last baby, I got sick again. I'm like, you know what? I'm not going to take chances. I need to look at these beautiful kids God has given me.
mm.
I need to live to able to see them, see my grandkids, or then maybe my great grandkids. Who knows? So I took a step forward. I went to see my PCP. That time I had one. Then so initially I was diagnosed with type 2. So when they started me with medication and all of that, I it did not work. So they ran more tests and they saw that I am type 1, which is I was born with it. So then I'm going to be on insulin for the rest of my life. I'm like, okay,
I
whatever.
get it.
So yeah. Then when my son turned 13, like I always say that in my interviews, I always say 14, but he drew my attention to it. That, mommy, no, I was diagnosed when I was 13 because I was in middle school. I'm like, oh, yeah, 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 yeah. So I saw all these signs and symptoms. Deborah, I did not pay attention to it. I'm like, I'm not going to think that, no. So I started monitoring him. Then one day, my daughter was like, "Mommy, see, these signs and symptoms Junior is having. I think he has diabetes." I'm like, "No, don't say that. He doesn't." And that time, my daughter was in nursing school. I'm like, "No, I know. I don't want, he doesn't. No, I don't want to think like that." But eventually, I took him to see the doctor. So
Mm,
I told the doctor all that, and they said, "Okay, then let's check his urine and see if there's sugar in it." Oh my God, Deborah, my son's urine was full of sugar.
wow.
Then they did a random blood sugar check, and my son's sugar was 450 milligram per deciliter.
Mm,
Like I froze. I was just sitting there. I couldn't move. Then the doctor was like, "We're gonna call the ambulance, but for the ambulance to come and take your son." I'm like, "No, I would drive." "No, no, no. We're not gonna let you drive." I'm like, "Yeah, I can drive him. Let me drive." So I drove him to the emergency room because they had already called anyway.
mm,
So they then eventually he was diagnosed with type 1. So like I was so depressed. So one day I told God that I want to do something positive with us having diabetes because this is too much for me. Deborah, it's not easy taking care of a sick child. It's not easy. So that was when the idea of Frankel came.
mm.
So this is my story. This is my story. It hasn't been easy, but I'm glad that like I know what I know now.
Mm,
Yeah.
mm, mm. So this is her story. This is the story of Lydia Frimpong, who's the founder and CEO of Frankel Foundation for Diabetes. And I have learned so much from Lydia just having this short conversation with her that the first step to managing diabetes is owning it up, is to owning that yes, I have diabetes, but what
Mm-hmm.
is the next step? And
Yeah.
as you rightly said, diabetes is never, 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 never a death sentence. you can manage it. We are yet to find a cure for diabetes. Hopefully, the scientists come in with
Oh,
something.
hopefully.
Hopefully, but it is manageable, and you can live to the 70 years, 80
Mm-hmm.
years
Mm-hmm.
living with diabetes. All you need to know is that if you identify any of these risk factors that Lydia generously gave us, you want to go to the hospital. You want to check your status. It is better to know your
Mm-hmm.
status than not to know and live in the and live in disbelief of the
Mm-hmm.
likelihood of having diabetes. Like she rightly said,
Mm-hmm.
she was in self denial for a very long time. But her journey to being able to help herself and help her child and help humanity began when she accepted that yes, I have diabetes, but I am stronger than diabetes. And so that is the story of Lydia Frimpong, and she's telling everybody out there, whether you have a family member who has been diagnosed with diabetes, whether you yourself has been diagnosed with diabetes, that is not the end of the world. It is manageable, and you can live your normal life to as many years as your creator has given you to live on the surface of this earth. Thank you so much, Lydia, for that great education and for putting yourself out there to serve
Thank you.
humanity in such a great um, manner. Thank you so much.
Thank you. We give people time to ask questions. Then after that, we do free health screening. Then people like they find out that our sugar, oh my God. Then we refer them. And even some of them that because we get their names and telephone numbers, you try to call to follow up with them. They won't even pick up because like they are scared to hear whatever. So we've done a lot of programs. In 2019, we did big one at Kumasi. We did it at Jubilee Park in Kumasi, and that one to God, we screened about over 1,000 people. And with our random blood sugar check, we were able to. They were not like actually diagnosed, but we suspected them to have diabetes. So we referred them to Konfanochi Teaching Hospital. Then we did a program with Dance Monkey Fit Club in Accra. We did a big program at Ebri Gardens. We did another big program at Gomoa Buduburam in the central region. Then we've done a lot of programs. Oh my God, it's uncountable. And all these programs, I share my story and I inspire people. We give free medication. We've done a lot of donations as well. We donated insulin to Rich Hospital because they had just opened this adolescent diabetes and family department. So we donated to them, and they were so grateful that some of the patients who don't have money to buy insulin, they were able to get free insulin, and the pharmacist will call me and say, "Oh, Lydia, God bless you for everything you're doing. Like you saved people lives, And I felt good about myself. Then
Oh,
we donated like adult diapers because somebody donated to us here and I shipped them and we donated them at Legon Hospital. We also donated some at General Hospital in Accra. So we've been doing a lot of stuff, a lot, a lot, a lot. And I'm so proud of my team for doing all this wonderful work.
thank you so much, Lydia. That is awesome. Now, let's talk about the program that we are having in on November
Yes,
6th.
yes,
So,
November 6th.
to my viewers, Frankel Foundation for Diabetes is holding a program that we call it Diabetes Know Your Risk and Stay Aware, and it's happening in Kumasi on November 6th, and we're going to have a short discussion on that. And so, if Lydia
Yeah.
can take us through that event, what is happening on November 6th?
So on November 6th, we having this big program, which is not new to us as an organization. You do that most of the time, but usually we collaborate with people or big entities so that they can get more people to attend the program. So this time I was so lucky, very, very, very lucky. I have a friend in New York. Her name is Dadaba Ifiabuachi. She hooked me up with her brother. Her brother is the member of parliament for Bantima, and he's also a minister for works and housing. So, like, the brother just dived into it and said, "Yes, I will collaborate with you guys and have this program done because diabetes is a killer. It's a silent killer. It can mess you up big time." So he's just in full support. Like, so we're gonna do education. We're gonna, after the education, we'll give them the platform to ask questions. And after, we do free health screening. We check blood pressures, we check random sugar, we check their eyes. And we have Lions Club. They usually donate free eyeglasses to Frankel, so we give them out to people because we have ophthalmologists on board to do the eye exams. Then yeah, we do blood sugar check, we do BPs, we check weights as well, then BMIs, just to, at least for people, those who don't have it, they will know their initial status, because it's better to know than not to know at all. Yeah, so that's what we're going to do. It's going to be massive. I'm so excited about it. I'm so excited. Yeah.
Awesome. Thank you so much for doing this. If I were there, I probably should attend because it's really a silent killer, like you said,
Yes,
and
it
not
is.
everybody wants to take that risk to even
Mm-hmm.
go and do a checkup and all of
Yeah.
those things. Thank you so much for doing that for people and for humanity and for
Thank
helping to save lives. And let's talk about the long run. Like, what is Frankel Foundation looking at? What are some of your future plans and objectives? How far do you want to see this foundation go?
Oh my God, Deborah, you want to know? I
I
want,
want to know.
Franco, we want to be at the top
Mm,
by helping people. And our long term goal is to build at least two big diabetic center in Ghana, whereby people will have either free healthcare or very, very affordable, like, healthcare,
mm,
because, Deborah, living with diabetes is very expensive, believe it or not. And diabetes can happen to anybody, whether you are poor, whether you are rich, whether you're handicapped, whatever. It can happen, like, anybody can have it. Anybody. To live with diabetes is very expensive. And every year we have this World Diabetes Day, and the whole of month of November is Diabetes Awareness Month. And November, I don't joke. November, I don't joke, Deborah. So, and this year, and every year they select a theme. But for this year alone, the theme is going to be this year, next year, and 2023. And the theme is access to diabetes care.
mm,
There are a lot of people, even here in America, there are people living with diabetes, but they don't have access to the care. They don't have access to insulin. Insulin was discovered 100 years ago.
mm,
Yes, in Canada. And it was a life saving miracle for people living with diabetes. But still, people don't have access to insulin. People don't have access to diabetes care. People don't have access to even medication, you know.
mm.
So, like, as I said, we are doing everything possible for Frankel to be able to, through the help of big corporations, big companies, donations coming here and there, we can also make a change in people's life. So that is our goal. That is, because, like, anytime we have programs, like we do health screenings, Deborah, you come see me. I'm all over the place, interacting with participants, like going up and down. I enjoy what I do. It's like, I love it. It's my calling. That I always tell my husband, that's my calling. I'm not a businesswoman. I'm just this. This is how God wanted me to do. So that is our goal. Like, one of our biggest, just to be out there, be able to help people, able to encourage people to donate to us so that we can also help people. Because, for instance, somebody can go to the hospital, be diagnosed with diabetes, like in Ghana, the person will be diagnosed with diabetes. Okay, fine, I have diabetes. The doctor
Mm.
will prescribe medication for the person. Maybe the first month, the person can get money to buy the medication. After the first month, the person doesn't have money for a follow up care. The person doesn't have money to eat right. The person doesn't have money to continue with their medication or whatever. So the person is just there for death to come and take the person away. And trust me, diabetes can kill you just like that.
Yeah.
People are afraid of HIV/AIDS. People are afraid of cancer. But Deborah, trust me, every year, more people that die from diabetes is more than people with HIV/AIDS and cancer combined. So
Mm.
just imagine. So Frankel Foundation as an organization, we just want to be able to help people, especially those back home. Yeah,
Yes, and we just want to help people as humanity. What are we living for if you're not able to
exactly.
help people? So visit Frankel at www.frankeldiabeticfoundation.org and send your donations to there. They are doing a wonderful job and we all want to support. As and again, I'll reiterate Lydia's words. Diabetes is not a death sentence. There is
Yes.
not a definite cure for diabetes,
Mhm,
but you
mhm.
can control diabetes and you can live your normal life
Oh, yes.
like any other person,
Mhm,
just by following your medication and
mhm.
first and foremost knowing your status. And so
Yes.
if you have a family track record of diabetes, you want to go and you
Mhm,
just want to go for a checkup with the doctor
mhm,
to see your status. And as Lydia said, it's the first step and it's the right step to do. It's such a wonderful conversation I've had with
mhm.
Lydia this afternoon. And Lydia, do you have any last words for our audience out there?
Okay. Huh. Well, I just want them to know that diabetes is real.
Mm,
It's a silent killer. It can kill you just a jiffy. And when you start having the complications of diabetes, is 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 the complications that bothers me, because
mm,
the complications are so deadly. Diabetes, when you don't take care of yourself, you don't bring your sugar level to a manageable level, and you start having these crazy complications like what? Your eyes, you get blind. Your nerves, it will attack your nerves. You will even have feelings in your feet, and something can cut you. You wouldn't even realize it. Before you know, it's too late, and they have to have your leg amputated.
mm,
Heart diseases are one is the number one disease that are killing people living with diabetes, believe it or not. Like stroke, you can put 100 people in a room with stroke. Trust me, 99%, 99 of them will be having diabetes, like they have diabetes. So diabetes is a killer. So we should just continue to do checkups. Hey, if you have the insurance, use it. Go for your yearly checkup. If you have family history, just let your doctor know, oh, I have a family history of diabetes, so I want to be checked out. The doctor can order tests for you for that to be done, for them to determine whether you have it or not.
mm.
So I want people to take very serious care of themselves. Exercise, eat right. Healthy food, they don't taste good, but you got to do what you got to do. So eat right, exercise, be active. Hey, take your medications, because living with diabetes, Deborah, it's not fun. It's not fun at all. And I remember one time my blood sugar dropped, and me, when my blood sugar is dropping, Deborah, it will get to like 100 within 30 seconds. My sugar will be like 40 something. That's
Mm.
how fast it goes. And I remember that time my husband was asleep. I tried to use the bathroom. I couldn't walk. I couldn't see my legs. So I had to lay on the floor and I couldn't shout. But thanks be to God that my daughter, for some reason,
Mm.
walked into our room and she screamed, "Mommy, mommy, mommy." And I couldn't, all that I could do, just look up and pointing at my bag because I have my sugar pills, I have my glucagon. So she went through my bag, grabbed, that time she was in nursing school. That's my oldest. She grabbed the glucagon. She doesn't even know how to mix it. But she did what she was supposed, like, she didn't know what she was doing. But she saw there was liquid, there was powder. Let me mix it.
Yeah.
Then she gave it to me. Then
Mm.
within 1 minute, my blood sugar started going up little by little, and I was able to stand up. I was able to talk, and so, like Deborah, diabetes shouldn't be taken for granted.
Mm.
Seriously,
Yeah.
if we need to talk about it, talk about it. Me, I'm available 24/7. Anybody can call me if you have questions. I always say that, Deborah, I'm not a doctor, but I live with it. I've lived with diabetes for over 24 years.
Mm.
I'm a nurse. I take care of people with diabetes. So I know so much about diabetes. So if you have questions, I'm available 24/7. Anytime you call me, I'll answer. If you have questions, I can answer some of your questions. Some of the questions that I can answer, I'm like, call your doctor. Tell your doctor this, and that. So we shouldn't take diabetes for granted at all. It can mess you up. Your kidneys, patients on dialysis, almost everybody is diabetic. So that's how bad diabetes can be. It can mess up
Mm.
your kidneys, it can mess up your nerves, it can mess up your eyes, it can do a huge damage, it can mess up your heart, and it can kill you. I always say that it's not a death sentence, but it can be a death sentence if you don't take care of yourself.
Mm. Mm. Mm.
Yes.
That is true. Thank you so much, Lydia, for that great education that you have given us here, and thank you everybody for joining us. Again, visit Frankel Foundation at www.frankeldiabeticfoundation.org. If you have any donations to offer the foundation, that is greatly welcomed, and also you can get in touch with Lydia, I believe, through the website. When you visit, you get her number,
Exactly.
and if you have any questions, you can
Mhm.
reach out to Lydia. Yeah, she's, as you rightly said, she's not a medical doctor, but what's more solid than somebody who has a lived experience of
Yes,
something, right? So,
exactly.
yeah, thank you so much, Lydia, for joining
And
me.
thank you so much, Deborah. Thank you for
Yeah,
having me.
and to my viewers, thank you so much for joining us for yet another exciting conversation on your favorite Fireside Chat series on the Ghanaian American Journal. It was awesome talking to Lydia, and today I have learned something that I didn't know.
Mhm.
Diabetes, know your risk and stay aware. Diabetes is not a death sentence. Diabetes is not curable, but diabetes is manageable, and you can live your normal life as many years as
As you
your
can.
creator
Yeah.
has given you
Yes,
if you
exactly.
know your status and
Hmm.
know how to manage it. Thank you so much. And we will see you again on this platform to have yet another exciting conversation. Have a good afternoon, everybody, wherever you find yourself.